group. This meeting is being recorded. So we will start with our kind of a roll call. We'll just see who is on the call with us. And hold on a second, and I have a list here, so I'm going to call out if that will help folks. I believe we have Greg Smith. You want to say hello and introduce yourself?
Good morning. Yeah, this is Greg Smith from Colorado Department of Human Services. And what else do you want to know?
No, that's good. Thank
okay.
You. Next, we have Maria Lopez.
Hi, my name's Maria Lopez, and I'm with the Clinic Tepeyac. I'm the new Health Promotions Director.
Welcome, Maria. Now, are you going to be replacing Susanna, or in addition to?
I am replacing her.
Okay. Great. Welcome.
Thank you. Susanna still works there, though, doesn't she, or no?
Yes, she does. She does.
Oh, okay.
She was. She's now the Health Promotions Manager, so she's still working here. We just have a really big event coming up on Sunday, so all her time is dedicated to working on that. And
so
I'm, I'm getting my feet back.
Sounds good.
All right.
So both of you, this is Connie, and hi, sorry.
That's right. Let's see, I have Kelly McCracken.
Yes, I am on the line.
Good morning. And where are you from,
Good
Kelly?
morning. From CDPHE.
Awesome.
From Colorado Department of Public Health and Environment.
Thank you. We get used to our little shortcuts. Ellen.
Hi, this is Ellen. I'm from Larimer County. I work for University of Colorado Health for Poudre Valley Hospital.
All right, welcome.
Thank you.
Samantha.
Hi, this is Sam Decker with Tri-County Health Department.
Great. Let me just see who else do I have. Crystal.
Hi, this is Crystal Ryder from the Southeastern Colorado AHEC, or Area Health Education Center.
Good morning.
Morning.
And then I have Glenda.
Yes, Glenda Mitchell with the Center for African American Health.
All right, welcome, Glenda. And then this is Mary Pat Gallus. I'm the Director of Implementation with the Consortium for Older Adult Wellness. And then also we have with us our faithful Secretary / Minute Taker, Cheryl Wakefield. Say hello.
Hi.
She's also with COA. And then is there anyone I missed?
This is, well, I chimed in, but this is Connie Young.
Oh,
with the,
okay, yes.
Department of Human Services, Division of Aging and Adult Services.
Welcome, Connie, of course. You aren't showing on my attendee list for some reason.
Oh, I'm sorry. I haven't gotten to the link. I just called in.
Oh, okay. Thank you. Sorry. I was going down the list.
Good morning.
All right. Well, welcome everyone. And
I think there was maybe someone else that just chimed in.
Hi, Mary Pat. It's Meredith with Telegen. I'm also only able to join by phone this morning.
Oh, great. Thank you. I'm glad you two have made note to me on that because it doesn't show up on our screen and I lose sight of the phone contact. Anyone else? All right. So we're going to get started. Our next slide. Let's see, enter, right?
Okay.
No. Where's my next slide?
Page down.
Let's go down here. Page down. All right, sorry, where is my slide movement? That's not it. Here it is. Okay, there we go, agenda. So we did our introductions and just reminding everyone that we are being recorded. I'm having technical difficulties. Sure. Golly gee. That's not doing it. Stop. Okay, so anyway, till I get another staff person here, you can see your agenda in front of you. And our next item is any report that we might have from Kelly McCracken.
Hi there. I just wanted to let everybody know that all the changes or corrections that folks sent in have been made into the database regarding the license holder names, so that's been corrected. We are more than happy to create any of those reports that people might want to see for their particular organization from the NCOA database. So just let us know if you want one of those reports. I think Lori just made them for all the license holders and sent them to Connie to use in their reporting that they need to do for NCOA. So we've got those and are welcome to share those if you need those for any reason for your own organization. I also wanted to just make an announcement, if that's okay, that's sort of related to this group, at least in a roundabout way. We've had discussions in the past about what the Diabetes Self-Management Program, the Stanford program, might look like if it becomes encompassed into an accredited diabetes self-management education program. There's a lot of thoughts, opinions, back and forth about that process, and I think all of those things are valid and need to continue to be debated and thought about. But what I did want to let everybody know is that starting in FY16, Colorado Medicaid is going to reimburse for diabetes self-management education. 30 other states Medicaid already reimburse for this, and all private health plans and Medicare reimburse for it as well. So we're thrilled that Colorado has sort of come on board with reimbursing for this, and this is the accredited program by the American Diabetes Association and the American Association of Diabetes Educators, and now it will be a covered benefit under Medicaid. So I just wanted to let folks know that that's going to start in FY16.
So Kelly, what does that mean for us in terms of getting programs online that could be reimbursed under Medicaid?
Yeah, I think it's just maybe another thing to think about if, you know, a diabetes self-management program, so the Stanford program, if an organization offering that works maybe closely with an organization that has the accredited diabetes self-management education program and they're interested in offering the Stanford program as part of that curriculum, there is now a potential, you know, to share some reimbursement because Medicaid is now reimbursing it. I don't think this would be a game changer for maybe a decision to do that, but it could be part of what somebody thinks through as they're considering that potential partnership between a Stanford program and an accredited diabetes self-management education program. So I just wanted to bring that up, that's now another reimbursement stream that people could consider.
Mm-hmm.
That's great. And this is Connie again. We have talked on this call about pursuing the diabetes self-management education program for Medicare reimbursement. So that would be another great avenue to pursue. It does take some time to get that up and running and accredited and all of that, but other states are doing it, and you know, Medicare reimbursement is pretty significant in terms of it being a medical benefit. I don't know how that'll work with Medicaid or if it's different funding levels. Do you happen to know?
From what I understand right now, they're still working out what that reimbursement will look like, but from what I've heard, it will be 77% of what Medicare reimburses. So 77% of what they reimburse for the group-based and the individual reimbursement for diabetes self-management education.
Okay.
Kelly, I have a question. This is Mary Pat. Would that that submission for reimbursement actually go through the accredited partner?
That's
and we
correct.
just are the license holder that's partnering with them to provide the program, but they actually need to be the organization that makes the request?
Yes, that's my understanding. Okay. So the accredited program would hold the, well, they hold the accreditation and the ability to be reimbursed, and they are likely folded into a provider or some kind of organization that, like a hospital, something like that, that already has a way to be reimbursed by Medicaid. They're a Medicaid provider. And so this is just my thought, but that if, a organization offering DSMP, the Stanford program, wanted to partner with one of those programs to build the Stanford DSMP into the curriculum of an accredited DSME program, because it's more than just the classes. There's other aspects of a diabetes self-management education program.
Right.
In terms of, how it's accredited and that kind of thing.
Right.
Then that could be an MOU or a contract or an agreement or an arrangement between the license holder offering DSMP as part of that DSME curriculum, that there's some sharing of that reimbursement. I think that's going to be an organization to organization conversation, but I really just wanted to make the announcement that now it will be a covered benefit under Medicaid. And so, it's just, and that I'm guessing that's a lot of the population that folks might serve. And so there could be some possibility there.
Absolutely, yeah. I think that is good news, and I'm sure besides COA, many of them are already partnering with folks that are doing diabetes education, even the DPP program, and now this layers in, I think, that third option to their patients, which we've heard requests for. We've done some of that ourselves, especially like with St. Anthony's Hospital through their diabetes education program. But now there's potential to maybe look at some reimbursable opportunities.
So
I'm
sorry, I have a quick question. I don't know how to raise my hand. Can we do that in the online, or do we just kind of say I have a question?
I don't see a raising your hand option, sorry.
That's okay, because that would be, I just didn't want to be rude.
No.
Okay, I do have a quick question. I don't want to take up too much time on this topic, but I'm very interested in a few things that are talked about. Is there somebody we could follow up with, or are there links available online that you could send or email to us so we could kind of read more and then follow up? Because it's going to take me a minute to kind of process all of the different things this might mean for our organization.
That's a great question. We don't have any. Okay, let me start over. Because this is so new, there's not. A process is just now sort of getting hammered out about what this reimbursement is going to look like for Medicaid for these accredited programs, and then to further extend that into thinking about how a DSMP program could become a part of that has not been developed yet for Colorado, but there are definitely there's information out there at the national level about how a DSMP program could be part of a DSME program. I know CMS has done some of that work, and I think I've got those slides even somewhere from one of the last conferences where they did a presentation on what that could look like. COA has done some of that work here in Colorado, so they're a great resource. But Mary Pat, I can send, I'll find those slides from Tim McGraw, I think his name was, and send those so you can at least look through what that might look like.
Okay.
Hey, Kelly, this is Connie, and it's Tim McNeil, but there's some great
thank you. Tim McGraw, that's like a country.
It is. I was thinking, whoa.
Yeah, he's got a couple
he wears
careers.
Many hats. He wears many hats.
One of which is a cowboy hat, apparently. But there are tons of wonderful videos and the National Council on Aging has done related to CDSMP, and there are at least a couple related to the DSME and Medicare reimbursement. So I can send you that link. I could send it to everybody if you'd like, but
thanks, Connie. I'll let you do that.
And then it has a whole list of the webinars that are available, and you can look down and see diabetes and chronic disease self-management, moving towards sustainability, et cetera. It is complex, but this has a lot of great information. It doesn't pertain specifically to what Kelly's talking about with Medicaid, but it's all the requirements that we would need to fulfill in order to have an accredited program.
And that's what I'm getting at. So thank you. I just came from CDPHE, and I worked in HIV, viral hepatitis, and I've been kind of in healthcare for 14 years. But this is all very new to me. So I want to bring structure in and also also revenue and more stability for our health promotions, department. So that information would be perfect, actually.
And I assume that's Maria?
Yeah, it's Maria.
Okay. Well, we're right on the verge of hopefully doing a lot with sustainability, so your timing is great. And I'm sending you that link. You can scroll down the list of webinars and give me a call if you have any questions.
I appreciate it very much.
Mary Pat, this is Meredith. I can also check in with our National Coordinating Center since we're contracted with Medicare to see if they're aware of any states that might be willing to present a partnership that they have similar to this that's been working.
Oh,
That's a great idea.
Yeah, that's awesome.
All right. Kelly, anything else?
No, that's all I've got. Does anybody have any questions or anything about the data stuff? Reports? Any requests?
Well, I have a lot of questions about that, Kelly, but again, would I be able to email you, because I feel bad, and then I also am way behind everybody else, and I've gotten kind of a brief update internally, but I would love to be able to chat with you and get some pointers and things like that if possible.
Yeah, I think what I would recommend is maybe starting with Lindsay Blackwelder, because she controls that process about submission and how you're reimbursed and that kind of thing. And then if you have further questions beyond Lindsay Blackwelder, reach out to me, and then I'll do my best to answer them, and if not, I'll connect you directly with Lori Scott, who does the entry for us into NCOA's database.
And how do I get in touch with Lindsay?
Mary Pat or Connie, or maybe shoot her or maybe we could put it in the minutes or something.
Okay.
I can just send her. I can send you Lindsay's email, Maria.
Thank you.
Thank you. Any other questions or concerns?
Quick question, Kelly. Do you know? I believe. Excuse me. I believe our database, your database that you've been collecting, has the type of class as well. CDSMP, DSMP, et cetera. Okay. I have a request that I'll get back to you on later.
Okay. Sounds good. And maybe send the request directly to Lori. She can pull whatever you need.
Okay. Sounds good.
All right. Well, thanks for your time. And if any questions come up, I'll still be on the call.
Thank you, Kelly. All right, we're going to move on to our next item, which is just an update on Year 3 grant, and that would include hearing from Connie on carryover funding and sustainability plan.
Okay, thanks, Mary Pat. The carryover funding is the paperwork for that is expected to be signed off on the final signature early, probably Monday. I'm hoping so. As soon as that happens, I'll get that to Lindsay so she can give you the go-ahead on that. There's a related item that comes later that we'll talk about regarding trying to reach some of those counties that we haven't reached yet, but we'll come back to that. The sustainability plan, I sent out the minute or the summary from the meeting in January. I thought I had sent that out already, but it was the interview summary. So if you want to look at that and have any questions or comments, please send them my way. Be interested in hearing about that. And hopefully we'll have the plan reviewed and finalized, if not late May and early June. Just a lot of other pending and pressing deadlines that have been here for the past couple of months, and when we first got it in, it needed some reworking in terms of the technical, just writing, editing, that kind of thing. So it's still in the works. No worries there, just delayed.
Okay. Connie, are we still looking at the potential of having an in-person meeting and summary of that, or what do you think?
Not in person, but conference call, yes.
A call, okay. And that would be separate from our collaborative meetings, correct?
Yes, because, it would take, we'd probably try to do an hour and a half type of call for that as well, since it's pretty meaty.
Yeah, I figure that's good information. And maybe that would happen sometime in June, maybe even
June, yeah.
Okay.
Yeah.
Just to get a plan.
Sure.
Right. Great.
And we would just get that report maybe in advance, so we would have time to
Yes.
process it. Okay, cool.
Yes, definitely. Yes, definitely. Would a week, should I give you like 2 weeks? Or?
I mean, for me, ideally 2 weeks just because I'm newer, but I mean, I understand how short timing is, but that is just me being totally selfish and saying ideally
No, I'd like to give,
weeks.
yeah, I think 2 weeks is reasonable, plus people are, out of town and all of that, so I'll shoot for 2 weeks.
Anything else on our current year grant, Connie, that as far as, I know we have some specific topics. Should I just move on?
No, I think we're good there, unless anybody has any questions.
And as you saw, there's some other topics that are regarding this current grant that Connie will address here. So our next topic was any update we might have on health links, but I know Connie.
Yeah. We were hoping, I just tried to get a hold of the person from HealthLinks a couple days ago and haven't heard back, so I'm guessing she's out of town or out of the office, so I'll try to connect with her and shoot for something on next month's call, or some interim communication via email. And just for people who haven't heard about HealthLinks, it is a branch of the Colorado School of Public Health out at the University of Colorado, and what they do is one of the things they do is they have created this certification program for employers to certify their health and employee wellness benefit, or program that is. And they created this certification program as sort of a way to help employers, reduce costs for injuries and time away from work and that kind of thing, as well as to provide them a credential that says, hey, this is important to our company, and which is, attractive to employers and, other potentially businesses, I guess. In any case, they're interested and open in hearing, having us do a presentation about CDSMP to one of their groups that does outreach training to employers, so that they would communicate to employers about this program, and hopefully we could get some referrals to classes, and then maybe, especially hopefully, get some financial support down the road. So there was a number of people on our last call that expressed some interest in hearing more about it. I think for people who serve only individuals 60 and over, it would be less relevant, but certainly there are a lot of people in the workforce who are, on the low end of the 60-plus range, so there may be some opportunities for everybody, but more to come.
Okay, great. All right, I'm going to move to the next item, which is expansion of CDSMP by county.
Yes, this issue came up. We talked about this briefly on the last call, but the way this issue came up is we had a conference last week in DC, and before that, I was talking with a conference organizer about different things I could present about, because they wanted each state, I think, to present some of their success stories and that kind of thing. And one of the things they asked about is, and also, another issue related to county expansion is that in the original grant application, one of the goals was to expand the percentage of counties from, I think it was 62 to 95%. And I take partial responsibility for that, but it's been in our contracts as well. And so I looked at the percentage, and we aren't anywhere close to 95%. We've increased a little bit, but what I wanted to ask you, and the reason for my email about this and Lindsay Blackwelder's, was to see if you all could look at those counties and see if you could provide any of your remaining classes funded through either your original funding or the grant, the carryover funding in any of those other counties. And a related reason for trying to do this is that in addition to having identified this as one of our original goals, one of the other issues is that in applying for additional funding for the next 2 years, one of the, it's going to be, and I'm coming back to the reason for this, so bear with me. One of the criteria for the grant application is having met the goals that people originally established in their grant, and it will be a very competitive process. So if we can edge closer to that with your help, that would be advantageous to all of us. So I just sent you, this is a little while ago this morning, the list of counties. I wasn't able to get it to Mary Pat in time to pull it up on the screen, but you've seen it before, and just to run through them real quick, because you can sort of key in on any that are in your area, are Archuleta, Chaffee, Clear Creek and Delta. COA thought they might be able to do something there, but so far we haven't had anything in those counties. And I'm going back to the 1st of September of 2012, which was the beginning of this 3-year grant. The rest are Gilpin, Grand, Gunnison. COA thought they might be able to do something there as well, but to date we haven't done anything there. Hinsdale, Jackson, Lake, Park, Pitkin, Saguache, San Juan, Sedgwick, and I guess we can kind of count Washington. There was one class that I could find, but it was in the prior year grant. Your previous list also included Mineral, but Monica let us know that she's either done something there or is going to. But if you could consider if it's possible to do any of your remaining classes in those counties, that would be a great help.
I do have a quick question. This is Maria Lopez. So let's say we have a connection in the San Luis Valley, and that would be Saguache, Alamosa counties. I don't think you mentioned Alamosa. I think there were other counties there, but the Saguache area. And we had a partnership. Is that something that would be acceptable if we could manage? I don't know how we'd do that cost, but if that was something that we could do, is that something you'd want to talk to me about? Or do you just feel like if it, what exactly, kind of how could we, make it work?
Yeah, and I emailed you back about that late yesterday.
I must have missed that one.
That's okay. Well, if you don't have it, let me know. But I think that would be great. We do have a license holder in that area, and Monica Wolf, who is on the line today. She's with the Area Agency on Aging, and then they go by the name South Central Colorado Seniors. So I was just suggesting that you connect with her, and if you want, we could maybe have a conference call with 3 of us just to see what Monica's thoughts are in partnering, or if she, do you want to chime in on anything briefly now, Monica, or should we just talk about this afterward?
I'm not sure.
Are you there, Monica?
Today.
Oh, I'm sorry. I thought I heard her.
No, and I don't
imagining.
Looking at that, so I don't think she's on the call.
Okay, sorry about that. Yeah. So yeah, let's if you can touch or let me forward that email to Monica if I haven't already, and then we can see what the possibilities are. Do you have leaders in that area, or
well,
you said you have a connection? So I don't know.
Yeah, there's San Luis Valley-wide Medical Center, and I'm very closely connected with them, and I've done programming with them in the past. And when I saw the list come through, I thought, hey, that'd be great. And I know they have different mobile connections in different clinics and different connections within the valley, and they are a huge healthcare provider there. So I just thought that might be, it's something I could facilitate. I'm very, like I said, I'm very closely linked with the medical director there, so that would be definitely something that I think we could have some discussions with. And, we did some HIV programming there and some testing and some other things there, so yeah.
Okay, great. Yeah, I think it'd be critical to...
Can I interject?
Sure.
the center, we have trained a couple of folks that are with a group called People Cares, and as facilitators, and they're brand new, but we definitely need to get them totally on board, activated, and they have a statewide reach. I don't know what communities they really want to focus on at this point in time, but it certainly with some of those far outlying areas. Would you, now we were speaking of Monica, with which group?
She's with South Central Colorado Seniors in Alamosa.
South Central Alamosa, okay. And who was the other on the call that has spoken out?
Well, my name's Maria Lopez, and when I saw the list, I have a really good...
She's with Clinica Tepeyac.
Yeah, I'm with Clinica Tepeyac.
Okay. Hi, Monica. So, yes, I would like to be in that conversation, you know, because we do want to utilize those folks, whether it's here in Denver or in some of those communities, if they're able to go. And that's basically how they run their program currently, is in all these different communities.
So do they have leaders that are already trained in CDSMP?
Yes, we trained them in December.
Okay, great. Yeah, well, if you can take a look at that list of counties, Glenda, and see if there's anywhere you think you might be able to put something together, that would be my hope for prioritizing those counties over the next couple months.
Well,
it's not a lot of time, but you can, I'm sorry?
We'll reach out to them and let them know about that list and see which ones they might be interested in supporting.
That'd be awesome.
And then work with Monica and Maria on that.
Monica and Maria are just, Maria was just mentioning, I assume, Maria, that you're talking about the Tamondo classes.
Yeah.
Because that's specifically what you offer, is that correct?
Yeah.
So, and mentioning that they have connections down with Valleywide in the southern part of the state. So Glenda, you wouldn't need to coordinate with them.
To be able to get connected in there, right? Yeah. My question, I'm sorry.
Can I just finish up? Sorry.
Yeah, I'm sorry.
With Glenda, you don't offer Spanish language classes, do you?
No, we don't. So it could be as a joint effort to be able to cover something like that. If
so just
Maria's group is able to support it.
Just to clarify, though, you wouldn't, Glenda, you wouldn't need to connect with Maria or Monica. That's a separate initiative that Maria was suggesting, that maybe they could provide the Tamondo classes in the southern part of the state. So there really wouldn't be a connection that you'd need there. But so you could independently work with People Cares and see if there's any locations where they could provide classes in those unmet counties, so that would be great.
Yeah, see, they don't have to partner because since they're brand new, we do need to get them through those first sessions, and that's why they need to partner with someone that's already
I gotcha. In terms of having a trained leader.
Certified. Yes.
Yeah, certified leader. Okay, I got you there. So, yeah, would it work?
Glenda, this is Meredith. I'd be glad to partner with them. I've been through my first DSMP series, so I now have teaching under my belt. But if you want to connect, we can talk about that too.
And that's Meredith?
Yeah.
Was that Meredith? Yeah. That would be a great connection for both. Yeah. Thank you. And then if you, Glenda, if you find that there's any possibilities that Meredith is unable to, or they don't fit into her priority areas, then we could send out an email to other people and just see if anybody else can partner up with you.
Okay, we'll do that.
Sound good?
Mrs.
Great.
Pat, I think I'm just recalling that the biggest challenge may be having actual Tamondo leaders in that area, because Monica didn't have two. So I don't know if Clinica Tepeyac feels they have leaders that can reach into those counties, but just keep that in mind.
Yeah, and I was trying to get back to that. Maria, you don't are all your leaders in the metro area, or do you have any certified leaders that are down in the San Luis Valley area?
Yeah, that's what I was trying to, no, we don't. That's the simple
Okay.
answer. There's two questions I have. So I can facilitate a partnership, like, having people there, identifying locations, having somebody recruit. I just didn't know, is there an ability, what would that look like with our grant? Because obviously cost would be an issue if we sent somebody down there, or is there somebody down there trained? So that's kind of what I was going to ask. But my second question was around the prioritized counties. Is there a higher disease burden of diabetes in certain counties that you'd want to focus on, so that maybe when we wrote the grant we would say, hey, well, we did expand. We didn't expand the full way, but we did expand to those counties that were seeing, a higher disease burden or a higher diabetes prevalence. That way, kind of we were targeting where we wanted to go. Is that something that we already have planned? Because it could be. I just, haven't been able to read through everything yet.
Hi, this is Kelly.
Some of that was identified. Some of that was identified in the original grant, but we really haven't focused our efforts on that.
Okay.
Meredith is doing that more for her areas, but also I'm not just talking about diabetes self-management training, but any of the DSMP classes. It's a little, maybe you and I can talk a little bit more about the whole program as a whole, because like Glenda, who's from the Center for African American Health, works exclusively with diabetes programs, as does Meredith, who was just chiming in. So, but we're trying to expand the reach with any and on all classes that fall under the Stanford CDSMP purview. So sorry, I know it's a little confusing trying to digest.
No, it's great, and I appreciate the patience, because I'm new, so I really appreciate the education, and I will stop asking questions.
No, I didn't mean that.
Can I?
No, I will.
I'm sorry. Can I break in here real quick? This is Kelly from CDPHE. I mean, I know that we're trying to expand all CDSMP classes, and I definitely hear what you're saying, Connie. But I like that idea of, if there is a possibility to focus on these high burden areas in our state that have a high prevalence of diabetes, that's definitely an initiative we're interested in as well. And I can resend that diabetes fact sheet that we created about a year ago with our BRFSS data, and definitely the Eastern Plains, and specifically that southeastern region of our state, so Pueblo, Crowley, Bent, Prowers, Otero, Los Animas, Baca. This area is significantly higher rates of diabetes. In fact, for the state as a whole, we have about a 7% diabetes rate, but in that area of the state, it's 13%. So it's almost twice the state average. So, if there is a possibility of focusing our intentions with DSMP, and I'm not talking about the accredited DSME program, but the Stanford DSMP program, I still think that would be so helpful in these higher burden areas of our state.
Well,
sure.
Kelly, this is Crystal. I know that at Zacatec, I was just down in Springfield last week, and we have an upcoming DSMP training that we've offered to them, and I know that they have a really hard time, even whenever they've had classes, to get individuals to participate both in Prowers County and in Baca County. So we will continue to reach out to them, but I know even to get participants, it's been really, really difficult to get people to sign up whenever classes are offered.
Gotcha. Thanks, Crystal. Yeah, I can imagine
I would
that's
reiterate
hard.
that from COA, because we work with some partners down in that area too, and those classes are going, but they're small. Our completer numbers per class are probably 4 to 6. So it is
Gotcha.
A concerted effort.
Gotcha. Okay, thank you so much.
Kelly, this is Meredith. I would ask, in regards to that, is that something that the RICOs have been included in any of those conversations, or could they help with getting people into class in those areas?
Yeah, definitely. I mean, with this new DSME as a covered benefit for Medicaid, we're going to end up doing kind of a RICO roadshow to promote this and to get people on board with, encouraging that people with diabetes are, sent to these programs and that they take advantage of this reimbursement. And during that roadshow, we will definitely be talking about the Stanford DSMP program as well. And so that can be something we can encourage and continue to draw attention to the higher burden areas in the state. So I think that's a great idea.
And I wonder in the short term before that happens, even if they would be willing to have their care coordinators consider who could be attendees of the classes for the purposes of the state unit grant and fulfilling those classes by August.
Kelly, did you have any thoughts about that?
I'm not sure. And to say that again, Meredith, I'm not sure I quite followed.
I was just wondering if the RICO care coordinators who cover these counties would be potential people to tap into even in the short term in identifying folks that would be appropriate for the classes.
Yeah, I mean, I think there's been a fair amount of work with RICOs that Connie and Koa can speak to about kind of connecting. I don't think it's necessarily been in these counties. I think it's been more in the Denver metro area, but I might be wrong about that. But yeah, I mean, I think any outreach in regards to that is good. Our capacity is such that we probably can't start doing that, though, until we combine it with this other work.
And this is Connie from my involvement, and as far as I know, Koa's involvement with an AHEX was a couple years ago. So I think it would be worth reaching out there and trying to educate people, the care managers in that area. But I don't know if Meredith, do you have connections there that you're in touch with them, or?
I would have to look at the RICOs serving your specific counties to see that. We certainly have contacts with some of the RICOs. I'm not sure if we have them with all of them in those areas, but I can definitely look into that.
Okay.
That would be great. Maybe that's something, Connie, we can look at as far as one of those presentations. Is going into one of those RICOs serving that area.
Mm-hmm.
That would be a good idea.
Yeah, that might be.
Right. Yeah, and the RICO that serves the highest burden area is ICHIP, and we do have close connection with ICHIP for other projects that we've been working on with them, like a pharmacy project. But ICHIP is the one that covers that sort of highest burden area, and then Colorado Access is covering that more northeast section that's also a higher burden as well.
What does ICHIP stand for, and where are they?
ICHIP stands for Integrated Community Health Partners. They're called RICO 4, and they're in the southwest area of the state. So they're from Saguache and Mineral all the way over to Prowers and Baca. And then in terms of their north boundary, they do go up to Lake, but it's like Lake Chaffee, then Fremont, Pueblo, Crowley, and Kiowa.
Mm-hmm.
That probably would be a longer-term effort in terms of getting people on board with that we could look at doing, but I doubt that would help us with getting a class by August 31st. But it is a little tough, I mean, long-term is really important too, of course. But anyway, okay.
Good discussion.
So in terms of where to go from here on this, if you all could let Lindsay Blackwelder know, if you have a way of tapping somebody doing a class in any of these counties that I mentioned and that I emailed to you, that would be great. And then we can pursue some of these options as time goes on as well. So Glenda, checking with People Cares, and Meredith also, connecting with Glenda, and anybody else that I know. Mary Pat and Koa will be looking at some options as well. And anyone else, that would be great.
All right. Well, for the sake of time, I'm going to just move us on to the next topic, which is our, okay, now it's not doing it. That's the statewide fidelity tracking.
Okay. that's not quite showing up yet, but
No, it's not, and I'm having a glitch again.
Oh, okay. Okay, sorry.
That's the next topic.
That's okay, because I wanted to sort of give an intro to this anyway, but one of the, also in that conversation I had with our grant coordinator and NCOA about topics for the conference, they said, well, what about your fidelity tracking? Do you have something that's that you could share with that? And it occurred to me that no, we don't. So what you all, some of you worked on to update that fidelity review tool for when the fidelity checker goes out to review a leader at a class. That's great, and that's a wonderful tool, and I'm glad that it's been updated recently. What I was looking at though was tracking that at a state level, because as far as I know, we don't have any way that we know that somebody who is meeting their certification requirements, maintaining those, not doing classes unless they are in compliance with all of Stanford's requirements, and including fidelity checks. And I have on occasion been asked by various people, do I have a list of when their last class was? And this is probably people who don't do that many classes, but when is their fidelity check due and that kind of thing. So when I asked if anybody had something like that, that's kind of what I was looking for. I didn't get anything along those lines exactly. So I drafted something that I sent out just this morning, and if any of you can pull that up, since it was sent out late and not everybody's on the call, so I always try to send things out and get input from everybody. But if any of you can pull that email up that I sent out, and it's the link that, the attachment that's leader training.
Sorry. What time did you send this out at?
Just this morning. I don't know the exact time. But
I see it. Okay.
But it's called the Leader Trainer Fidelity Tracking Tool. And at a state level, and I'm thinking that at the license holder level, that something like this might be helpful, because Stanford requirements are pretty specific, as you know. So I just wanted to, I'll send this out for input, but if anybody who has been able to pull it up just now has any questions right now while we're on the call, or comments, or I can try to respond to those briefly. It probably takes some time to digest this, but across the third line down, those are three categories. I went through the document, the table I have from Stanford that summarizes the leader certification requirements, and so that's divided up by obtaining leader certification, the first part, which includes the fidelity visit, retaining leader certification, both within the first 12 months after the first workshop that the person's led, as well as on a subsequent basis. So I'm not sure how people are tracking that, but that is something that's important as part of your license. And like I said, it was also something that was kind of hinted at that we haven't been doing that and really should be, so from the federal level. So I'll send that out, and you can take a look and see what you think of that, whether you have questions about it, whether it would be useful to you, if you have something else that you're doing that you would like to suggest, and then we can go from there.
Well, I know from ACOA, we track this. Of course, we have our own data spreadsheet to track it on, and Cheryl, in fact, here is very good about reminding us as leaders need fidelity or something that's upcoming as we schedule classes and so forth, because it's, we have so many leaders, we have to really have a sophisticated system or we will lose track quite easily.
Right.
So I think that's probably the good and the bad of what we do. it forces us to have to really track it closely. And I think in our call last month, it was sort of determined that you are supposed to send that information to the collaborative, which would be here, and we'll file that stuff as far as the statewide collaborative level, but we're pretty sure we're not getting all of those. So that was also part two, I guess, of that.
Mm-hmm. So what would what is the expectation that people would send to the collaborative?
Yeah, at the bottom of every fidelity visit form, when that committee met, which was like Holly and Sue Milligan and Lindsay, and we did since update it last month, there is, it says send copy to the state collaborative chair, which at this point is still COA. So when folks are doing fidelities, we do get those. We have gotten those from other license holders. You know, in looking at the number of classes that are done across the state, we're fairly certain we aren't getting all of them, but we of course are filing what we get, and we do have that we have tracking of that, at least copies.
Well, the thing is, we have fidelities, but when we got the class information, there were no leaders identified. It was to be determined, and we were never informed when they determined who the leaders would be. And so we have a lot of things we cannot match up. We have fidelities, but we don't have them listed as having led any specific class that we have in our database, or we don't have the class at all, and a lot of them do match up, but it's not anything you'd want to take to the bank. Ours, you know, we do what we can.
There's some holes in it.
Yeah. Thank you. That's it.
Well, the other thing is that you can't. I don't see a way to track. Was this fidelity check done within the time frame allowed? Was it done on each?
We don't know that. Yeah, for
months?
all the other license holders, you're right. Each license holder does have that accountability as a license holder to do that, but right now we don't have a really effective method of tracking that statewide. I would agree.
So that's what I was asking about last time, is how people are doing that within your own agencies. And since I got one thing from Southeast AHEC that had some of that, but you know, I am of course concerned at a state level that we are not doing that as we should be, but then I would think at at the local license holder level too, that as Mary Pat said, that is a responsibility that's part of one of many responsibilities as part of your Stanford license. So take a look at that tool draft that I sent out and see what you think, if that would be something useful to you, or what. And we can talk about it again at on the next call. And if you have comments, please feel free to send them in, or please do send them to me in between now and then.
Yeah, I'm glad.
Do you have any questions about that? Right? Yeah.
Go ahead.
I just wondered if anybody had any quick questions.
Oh, I thought there was somebody. I'm sorry.
Connie and Mary Pat, this is Crystal. I'm just looking over our license agreement between us and Stanford. I don't know that I see anything on there that talks about fidelity. I mean, we've been doing fidelity checks. I'm just wondering, with the actual the license with Stanford, is that part of the requirement? I know that annually we have to report on the number of workshops, the number of leader trainings, and then also how many active leaders that we have, but I don't see that fidelity piece in here, though on the Stanford website there is a sample fidelity toolkit. So
it's not part of the contract, you're right. It's just part of that kind of standard operating procedures.
Right.
And that's why they post that guideline that Connie has shared. And that fidelity should be done once a year, et cetera, et cetera. So you're right, it's not a formal bullet point of our contract.
Okay.
There is
I'm not saying that we are doing the fidelity checks. I'm just throwing that out there just in general. So
I think that's a great point, because for them to really be able to have that, and this is Maria, to have that kind of capacity to enforce it, maybe that's a suggestion, you know, that they put it in the contract, if that's some feedback you could give to them.
Yeah, and I don't think Stanford wants to get into tracking everybody's fidelities, I'm sure.
I see.
I'm guessing that's why it's not. But there is, you know, best practice, so to speak, that if you're going to be a license holder and oversee leaders, this is part of the expectation. That's my understanding. But
and there's a whole 25-page fidelity manual from Stanford that I'm scrolling through to see. You know, there's a lot of must-dos, and I haven't looked through it to see what the requirements are, but, you know, I think it would be hard to push back against that with Stanford. So whether it's in the contract or not, I understand what you're saying. It's harder to, you know, enforce, but still we are getting funded from the feds at this point to follow Stanford's requirements.
Well, I think it's, you know, I want to say it's in between the lines, and what it means in that if you are sending to Stanford who your active leaders are, part of being an active leader is someone who's currently certified who has had a fidelity visit. You know, that's kind of the assumption. So I think that's where the catch is. That makes sense. Suffice it to say, we all just keep doing them. I mean, and I know, Crystal, you're doing them.
Yeah, it's just maybe the timeline. I mean, and I'm sorry, the second thing is that we did, well, some of you developed a fidelity checklist that Mary Pat recently sent out, as well as our fidelity policy within Colorado that spells all that out. And that was, you know, that's less teeth, I guess you could say, than what Stanford's requirements are, but ours was our way of implementing the Stanford requirements, and, you know, we could send that out again if that would be helpful. But yeah,
that was I know year one, if I'm not mistaken, of this grant, that committee gathered together to do that, which was part of the collaborative tasks at hand, was to standardize a little more the fidelity process. So definitely got it going on the right track, I think.
Yes.
Anything else on that topic? Anyone? Okay, I'm going to move to the next topic, and just as timekeeper, it's 10:02. So our next topic is highlights from the national conference that Connie attended last week.
And this will be really highlights. But we, a few of us attended that conference. It's it's not an annual conference. We had one 2 years ago, but this one combined CDSMP and the Falls Prevention Grant, which is a newish grant that Administration on Community Living has issued and is issuing more of. But in any case, there were a number of things that I thought were really beneficial. There were some great ideas about sustainability and marketing, and maybe we can, that being said, I don't have specifics to present to you, but there's all kinds of great slides and presentations from that maybe I can pull out some of those to talk about at the next or future calls, and maybe when Lindsay McIntosh is on the line, and also Katie Mortensen, maybe they can chime in as well, because they also went. We were able to send a second person under the grant, and in the past that's been Kelly McCracken went the first year from Colorado Department of Public Health and Environment, but wasn't able to go this year, and it really made sense to see if somebody from Department of Healthcare Policy and Financing, aka Colorado Medicaid, could go, and that's where Katie works. So, and she's often on these calls. Most of you know her at least by name, but anyway, she went, and then Sally Thoresen from the CDPHE who runs the Falls program there. So maybe we can have a little conversation about that at another call, and then I can give you some slides from presentations that I thought were really interesting, and pass on some of that learning and see how we can use it in Colorado.
That would be great. I think there's always good information you all learn at these national conferences.
Yeah, definitely.
That you share locally, and I like the idea of making it an agenda item, and we'll get that embedded into the slideshow early on. I need help.
That's a great idea. I should.
Yeah, well, give me time because I'll need it.
No, I'm taking responsibility for not doing that all the time. So
and I'm not good on the fly. All right, so we'll look forward to that. So our next item is, Connie mentioned, and might want to share a little bit on a new upcoming grant application.
Yes, and this will be brief as well, not because it's not really important, but because there's only so much that I have to share at this point. But I think most of you know, but if for anyone who doesn't, that ACL, the Administration on Community Living at the federal level, issued another announcement for 2 more years of a CDSMP grant. As I mentioned earlier on this call, it will be very competitive. In the past, up to now, I think it's been 22 states that were funded under this grant cycle. On this grant, they'll only be funding 10, and it's not limited to states. And the criteria mentioned that previous grantees can apply. However, they need to basically have good justification for continuing. They do want new and different kinds of things. So, expansion, additional areas of focus, that sort of thing. So I'm working on that. We have a 2-part process within our agency to get approval for grant applications. The first part is submitting a kind of a mini summary of what we would like to do and getting approval on that, and that's pretty far along, so we're assuming that that'll be a thumbs up, and so I'll be working on the actual grant application. It is due June 1st, so that will be done by June 1st.
You have a busy May. That's right.
Yeah.
Yes,
right. But I'm excited about it. I think we'll have a good shot, but it's not sure. It's sure not a sure thing or anywhere close to that. So. Okay.
I did have an opportunity to listen in on the webinar with, was it Better Choices, Better Health, Better Choices, the online program, and as they were addressing perhaps implementing that into part of the grant application, it was very interesting. So I know that perhaps there is some encouragement, I'll say, to include maybe online reach. Did you hear anything along those lines, Connie?
I think I saw that in the announcement as an example.
Okay.
But for us, we already have that, and we need to be sending people to take those online programs because we haven't gotten very far. We identified 50 people, and last time I checked with a person in DC, only a couple people from Colorado had taken it. So I'm glad you mentioned that. This is an opportunity for people to take the CDSMP grant. It's, as Mary Pat said, it's all online. They really try to mimic or mirror what happens in the in-person classes. Of course, you're not in person. You don't see somebody sitting next to you and all that. But, for people who are computer savvy enough and are comfortable communicating, there's so many ways of communicating now exclusively via social media and online that, some people get more used to that. And I have looked at some of that, and people do connect. I mean, if you make use of the bulletin boards and opportunities for interaction through the website that they have, it does give you that opportunity for support. People put out a question, other people give suggestions, and it's the action planning is part of it. So I didn't think of mentioning this, but I'm glad you brought it up, Mary Pat. Does anybody have any suggestions for how we, or should I just send out the link again for that and ask you all to keep that in mind for referring people when, for example, you have a class that doesn't happen, you only have a few people registering, and you think they might, and you could ask them if they're interested in doing something online. It's a real easy process of signing up, and we only pay for people under the grant if they are completers, just like with the in-person class. So they have to participate in 4 of the 6 online sessions. So there's not a huge risk in referring somebody who would end up dropping out.
That's a really good idea to send a reminder. I certainly can use it. And you know, after listening in on the call and getting much better feel for what that program looks like, and I now have a new appreciation for it, I guess I'll say, and also that it's a cost. I mean, with this grant application, you know, there's a per person fee to take the online class through this company that has exclusive rights to offer it. But what I'm understanding, Connie, and correct me if I'm wrong, is that you, through SUA, have some funds to do up to 50 people, and it would not cost the license holder or the individual. Is that correct?
Yes, that's correct. We set that up in this year. So we have, you know, we actually, now that I think about it, we really do need to get on that. So because, and right now they are requiring people to complete that within 12 months, which we're not anywhere close, but previously they had allowed for 18 months, and that 18 months would be for us. So I negotiated with our federal person to give us that 18 months, but that would that's through February. So I just can't imagine that it wouldn't be easy to fill, but we haven't done some good outreach and marketing on that.
Yeah, I'm sure.
I am curious though. So yes, to answer your question, it's already paid for through the grant. You wouldn't get credit for a completer, but certainly part of our motivation is to help clients or help participants.
Right.
But I'm curious, Mary Pat, what was it, if you can identify what kind of got you to be more convinced that this might be a good intervention? Because in the past I've kind of not heard a lot of people mentioning anything super positive about it.
I think, you know, I'll be honest, probably just bandwidth in that I've had such a focus of my time and energy on in-person classes, which we probably all do, but taking the time to hear a better explanation of the program and some of the advantages for an individual. I mean, the cost of the class is $275. And when I heard that, and then we have this grant opportunity, it gave value in my mind, to get individuals who we have probably missed and not offered the online. And I think we just need to do a better job of taking that extra step of offering that as an option. And I think we've just lost it in the shuffle, I'll be honest.
Yeah.
I mean, we have lots of folks who don't end up taking an in-person class. They're too busy. That schedule conflicts. And we as staff have not followed up with that next question. And now that I see what the value would be, I think it really brings it home. Is this have to happen by the end of August, or is this a different?
No, that's what it's probably confusing what I was describing, but we started it last September. And I negotiated with them to give us 18 months to reach all of those rather than 12. Otherwise, we'd really be in trouble.
Okay.
But so that 18-month period goes through, I think, the end of, I think through the end of February we have to reach those 50 or we lose the money. But I appreciate you mentioning that. I will send you all, it's real easy. There's a flyer that I created that kind of follows some of the information from NCOA about this online program, and it has testimonials from, they sent me a lot of testimonials. They picked out the ones that I thought were the most dramatic that were specifically from people who'd taken the online program. So there's several testimonials in there and a brief description of what is included, and then there's a link to sign up. They just say it has to be somebody who has a chronic health condition or a disability. They indicate that on the sign-up form, and that they're from Colorado, and then they're basically put in a queue for to be contacted as soon as they're offering a class.
Awesome. Good information. Any more questions about the upcoming grant application for Connie? All right. Well, we're moving right along.
I hope that, good.
Our next agenda item is just reviewing the statewide training that we've gotten word of. I know Crystal, and I think she has now gotten off the call, but she did ask that I forward her upcoming diabetes self-management program down in Pueblo area, coming the week of May 19th. That is free. We have a CDSMP one coming up next week. That's going. And then a pain cross-training in August that some of you have expressed interest in, especially applying for scholarship funding with those. And then, of course, CU Health Center has one coming in September. Anybody else have one coming that they just haven't sent on to us? Feel free to announce now.
Hi, this is Ellen. I just want to let you know that Holly and I decided that we're going to do the CDSMP on September 14th through the 17th, and we're going to go ahead and add the cross-training for the diabetes that additional Friday, the 18th.
Oh, okay.
All right.
On the 18th?
Right. So we'll try to finish,
we'll
pack in as much as we can, but yeah.
Okay.
Good. Thank you.
So they'll get cross-trained.
Yes. Thank you.
So Ellen, if someone just wants a cross-training, can they come to that if we have space just for that day?
The DSMP, the diabetes? Yes.
Yes. Okay. And Mary Pat, I have a question for you on your training, which is starting right up. I hope there weren't any scholarships that we didn't address, scholarship applications that we didn't address yet.
There is one that just came in yesterday.
Okay.
Email request, and she's got an application, and I would not be surprised if it's in today.
Okay, great.
But we can talk offline just
I'll make a point to
make sure we're on the same page.
Sounds good.
Okay. All right. Well, that
also,
about wraps it up.
Sorry.
Do you have something else?
I'm sorry. So hard to talk and not talk on top of people and all of that. But yeah, just a reminder, and we've talked about this before, but I do have some funding in this year's grant, this year being what ends in August, to pay for leader training. So we have some money for the scholarships, for partial scholarships to attend the training that COA does, and for people who are wanting to get cross-trained either locally or online through Stanford. Let me know of that. I'd like people who are interested to fill out the same scholarship application, just so we can make sure that, or be as sure as we can that people who are going to use grant money to support are really knowledgeable about what the requirements are and are interested and committed to following through. So, but if you have anybody, let me know, and we can send out the application and hopefully get some support for them to take their cross-training as well.
Yeah, awesome. I'm going to just thank you very much, Connie. We have been able to take advantage of some master training scholarship funds to support 2 master trainers in the Tamondo training. So very excited to have 2 master trainers in Colorado within the next couple months. So, and
yeah,
that help with that scholarship money. So thank you.
Yeah, that'll be great. And then we also have 2 people who are going to a regular CDSMP master trainer training the same week as the Tamondo one, the 18th of May, which is Tonica Ship from the Center for African American Health, and Augusta /Gussie Nishi, who works in Grand Junction with well, she has a number of different hats, it looks like, from some of our communication, but she'll work under the license that Sue Conry at Hilltop holds. So she's really excited about that, and the Center for African American Health has done so many great classes and has had to bring people in from other states to do some of their master trainer training. So have another resource for doing that in the future.
Cool. Anything else?
Mary Pat, this is Meredith with Telegen.
Uh-huh.
I'm just curious, based on the email that Holly had forwarded to the collaborative about the CMS, the Medicare funding available for data collection, is there anyone on the line who has taken advantage of that opportunity or is planning on doing so for DSMP participants?
This is Ellen, and we are looking into it. It's just in legal right now for us to be able to do it. So.
Okay.
This is Glenda Mitchell. Hi, Meredith. And if we could talk offline, I've got. I would like for us to move ahead with the request, and I've got some additional requests to go along with that, along the same line.
Okay, sounds good. I just we send reports into Medicare, so I'm curious if that process has been fairly simple, if it seems cumbersome, and how it's going for folks. So.
Okay, if we can connect, I would appreciate that.
Sounds good, Glenda. Thank you.
All right. Anything else? Anyone else? We're still holding on to a future agenda item on HIPAA compliance. I will add highlights from the national conference as a future item. Anybody else have any suggestions?
You could put health links and then,
okay.
Let's see, what else? Back to my list here. I think it seems like there was something else that the fidelity tracking.
Okay.
And I just remember a data report or something like that.
Yeah, and that's a normal item.
Oh, okay.
Thank you. Okay.
Mary Pat, briefly, what's the HIPAA compliance issue?
This had come up, golly gee, now it's been 3 months ago, and I want to say maybe it was Melissa who suggested that we just do a sharing time, kind of a brainstorming of how people are handling HIPAA compliance issues, what challenges they may have, solutions they have, that kind of thing. Just on tracking, keeping records, having leaders have information out there, et cetera, et cetera. So,
okay.
Without getting into it, that's what her question and discussion was.
Okay, thanks.
Okay. Yeah. I think just logistics of it, from a practical suggestions.
Okay.
Anything else? Anyone? I feel like that guy from Feral View. Goes anyone? Anyone? All right. Well, that's all I've got, and I think that's all we have. Our next meeting is scheduled for Thursday, June 4th, 9 to 10:30. Just a reminder that the July meeting will be a week later because it runs into July 4th. So keep that in mind for the next meeting in July. But other than that, first Thursday is June 4th. Everybody good?
Thanks,
Yes.
Thanks.
Thank you.
Thank you.
All right. Thank you all. Have a great day. I am going to stop recording.